is public health? Well, public health to me, it's just how it sounds, the health of the common health of a community. And so I believe public health simply ensures the sort of the safety, the health, and sort of the well-being and the futures of communities. And so I think what public health does really is it constantly sort of assesses problems that is happening in our communities and they continually monitor and check um, what sort of issues are going on in the community.
Public health is really everything and anything. Public health is about protecting and promoting the public's health in all that it encompasses. It's about adopting health as more than just physical and more than just healthcare, but it really encompasses all of what we have to offer. It's physical, mental, spiritual, emotional, and that's what public health is.
Public health, as it relates to assurance, is really just making sure that people have the access and are able to have the personal health kind of needs available to them in the public. It means having private health care, kind of having all of the things that you need in order to live kind of like your best life or living up to your best potential.
I have really enjoyed my time studying public health at Hamlin, and currently I work at a mental health facility, and I see this as something very important to sort of our community and public health at large. I currently work with people who suffer from mental disabilities, such as schizophrenia and bipolar mood disorders. And I have really seen myself gaining a lot of skills and learning so much about mental health and public health at large.
I am deeply passionate about advancing public health and health equity through public policy and legal advocacy. I recently participated in a Capital Pathways internship with the Department of Health and Human Services as a community supports administrative legislative assistant, and that's really where I see public health impacting our state and governmental systems at a meaningful level, and that's where I see the future of my career taking me.
I graduated in May, and for a while I was working at Medica, kind of in their private health insurance, like individual and family health insurance, but right now I'm working for Cigna Behavioral Health, and I work with providers in getting authorizations for inpatient substance abuse and chemical dependency and mental health. I also kind of do a lot of the billing. And then also on the side, I am a birth doula, so I work with mothers on government health insurance, and I make sure that they have healthy births, and a lot of the population that I work with are people of color, and I have about 3 or 4 births a month, and yeah, it's really nice to see kind of the chance for moms to have a beautiful pregnancy and then also have somebody there to support them throughout birth, and just have access to someone that they trust and feel comfortable with.